time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, Chris. Paul J.
Morning, Doc. It sure seems like we're talking about the flu a lot earlier than usual. We're being urged to get our flu shots ASAP, and there have been all sorts of news reports over the past few days about a newly approved drug to lessen the symptoms of the flu. What's the story here?
Well, as you remember, last year's flu season was a rough one, and the best thing we can do is get a flu shot to try and help us all develop herd immunity to lessen the chances of significant outbreak between now and early spring. And the new flu treatment is a welcome addition to our toolbox. We're hoping we can tap into this to help reduce the severity and duration of the flu bug for those who catch it.
Can you tell us a bit more about this new treatment?
Sure. This new drug is called Xofluza. It's the first new antiviral flu treatment. It has a novel mechanism of action. It's the first one approved in about 20 years by the FDA. In testing on more than 1,000 people, Xofluza ended coughing, sneezing, and fever and aches in just over 2 days on average. So it's actually best to try and avoid the flu through vaccination and good hygiene practices than to count on a symptom-reducing medication after you've already come down with it.
All right, the next topic we're talking about this morning seems kind of dramatic at first blush. A top cardiologist is warning of highly significant perils associated with inactivity.
Yep. Physicians and other healthcare professionals have been urging all of us for years to work at least 30 minutes of brisk physical activity into our schedules most days of the week. But lots of people aren't really taking these to heart, these recommendations, that is. We're hoping that this new study from a respected cardiologist at the Cleveland Clinic will change all that. The study, which involved more than 120,000 patients, found that a sedentary lifestyle is actually worse for your health than smoking or diabetes or heart disease. The key message from this massive multi-year study is we're meant to walk and run and exercise. It's all about getting up and moving.
Well, Dr. Bramwell, finally, since tomorrow is Halloween, do you have some public service hints to keep the day's hazards in check?
Yeah, it seems like such a simple, fun day of decorations and costumes and candy. But as any ER doc will tell you, it can be a pretty busy day for them. For instance, last year, pumpkin carving accounted for nearly 3,000 visits of the 16,000 Halloween-related injuries treated in the U.S. emergency departments and doctors' offices and clinics.
So, man, I hate carving pumpkins, too. So are we just supposed to say no to the whole idea of creating our own custom jack-o'-lanterns?
No, that's a little extreme. We did ours last night at my house. The suggestions being offered include the following. One, use a pumpkin carving kit or knives that are specially designed for carving. These are less likely to get stuck in the thick pumpkin skins. Number two, carve pumpkins in a clean, dry, and well-lit area, and make sure there's no moisture on the tools or your hands. And that takes a little doing with pumpkins.
No question.
Number three, use non-flammable light sources like glow sticks or artificial pumpkin lights instead of the candles inside. And consider having children decorate pre-carved pumpkins with stickers and paint to avoid their use of sharp objects.
Well, Dr. Bramwell, you have a happy Halloween at your house, and thanks for joining us this morning on KBOI.
Thanks, Chris. Thanks, Paul J.
Thanks, Doc.